New tonight, many questions being raised about a public service announcement by the Rhode Island Department of Health about how to prevent a drug overdose. Critics believe the state is promoting drug use, but state health officials say there is a lot more to it than that. ABC 6 News anchor Darren Botelho joins us now live in the newsroom with a look at exactly what is going on here. Darren.
Yeah, John, if you go on Facebook or Twitter right now, you'll see dozens of people confused as to why this state would be posting tips on doing drugs online. But state health officials say this isn't about promoting drugs, it's about saving lives.
A Rhode Island Department of Health post dozens of social media users deemed controversial, with 4 tips to help avoid an overdose with fentanyl, like avoid using alone and take turns, and start with a small dose and go slowly. This is Angela Merritt, one of the people who commented on the health department's post.
It's ridiculous. It's laughable.
Accusing the state of promoting drug use.
And giving them directions on how to use drugs and do it safely instead of stopping the problem that we have.
But the interim health director for the state, Dr. Jim McDonald, says you can't stop the problem and help someone get off drugs if they're dead.
What you have to do is try to keep people alive so you can get them into treatment. So the main message there is we want to keep people alive long enough so when they're ready to get a treatment, we can bring them into treatment.
Merritt says this public message on social media isn't just visible for drug users seeking treatment, but impressionable kids as well.
I think they should take it down. I mean, when I was growing up, it was the basic bottom line was just say no. You don't do drugs and that's it. When you do drugs, you know what's going to happen. You're definitely pushing the wrong message, especially to children and young people.
But Dr. McDonald says with addiction, the simple message of just say no just isn't enough.
It's a simple message, and I think sometimes we love simple messages, but it doesn't mean they're proven public health interventions or proven public health strategies.
And John, this controversy comes just several weeks before a new law takes effect here in the Ocean State that would allow for so-called harm reduction centers where people dealing with addiction can take heroin or any other illegal drugs with healthcare workers right there, just in case something happens like an overdose. Live in the newsroom, Darren Botelho, ABC 6 News.